I think most people are looking for someone that they can ultimately trust. Anytime someone goes through an injury, it can be a really trying and emotional and difficult time. And so I think having a doctor that can empathize with the patient and help them honestly kind of understand what's going on and try to minimize terminology that could be confusing, I think is really important. I'm Drew Freese. I'm one of the new orthopedic sports medicine surgeons at AOA. I went to med school at University of Texas Medical Branch in Galveston, Indiana University in Indianapolis for my residency. And then I did a one-year specialty fellowship in sports medicine at University of Iowa. My main focus was the Iowa football team. Probably my most common surgery is ACL reconstruction in the knee and rotator cuff repair in the shoulder. So I've been in practice here in Dallas just over a year now. I see patients of all ages, specialize in sports medicine, so I do primarily any repair or reconstructive surgery of the knee, shoulder, and elbow, but I also see general orthopedic fractures, and I do see pediatrics and kids of any ages. I was a big sports fan growing up. Friday Night Lights is kind of how I remember high school, and so going into sports and being able to come back to an area where not only football, but every other sport is growing and becoming more popular and provides a great opportunity for sports medicine physicians to make an impact in the community. The most challenging case I've done was a young kid. He was 19. He injured himself while he was in Peru on a mission. He, unfortunately, just because of the circumstances, couldn't seek medical care at the time. Had an ACL tear in his knee. He had a pretty significant meniscus tear. So at only 19, he had a pretty catastrophic knee injury. I was able to reconstruct his ACL. I actually did a meniscus transplant and a cartilage restoration procedure for him, and it was a long, complicated procedure, but he did a great job in his rehab, and he, fortunately had a good outcome. I'm most excited about collegiality. I think some of the things that drew me to AOA is that it's a large practice. They have all areas of orthopedics represented. I think having a lot of other partners that I can bounce things off of and talk to is something that I'm really looking forward to. I know how important it can be for a lot of people to have an active lifestyle and what that can do to their overall quality of life. So I just hope that they know that I did everything I could in their best interest, hopefully get them back to doing what ultimately makes them happy.